Thank you very much. Minister, thank you for taking the time to be here. And you were at that meeting that we both attended on Monday evening in the Shearwater Hotel, where GPs came together representing the Ballinasloe and the Southeast Galway area. Those GPs came from group practices, Marina House Medical, the Dunlow Medical Centre, very well known in Ballinasloe town. But that covers a huge area. It's not even just Galway, but it's South Roscommon because we're right on the boundaries. So you're talking about Top McConnell, Moore, Aughrim, Clontuskert, and then we also had GPs representing single group or single practices. We had Dr. Mary Murphy from Lawrencetown, we had Dr. Ranga from Aircourt, we Kiltormer, Dr. Sargeson, and Kilconnell, of course, where there's a locum, where we don't have a GP. Minister, you'll be very aware that over the last number of years we've raised this. I've raised this, and I know other public representatives have raised this, that the group, the network of GPs that provide an excellent service there, they provide a service that goes on 24-hour, 365 days a year. They do nighttime cover and they do weekend cover. But yet these GPs are suffering, and they're suffering, and our patients and families in the region are suffering. It is at a crisis level because they cannot access Westdoc supports. Westdoc, of course, co-funded by the HSC, that can provide cover, that can support GP networks all around the county. But there's challenging areas. East Galway is one of them, Southeast Galway. I know Portumna in your own area, Minister, of course, is a big challenge, and of course Moycullen. These are areas around our area in the west that's a huge challenge for recruitment and retention. How on earth can we attract quality GPs who started life to live in our region, to perform an invaluable service to our community, to be the first point of call for people when they're getting checks, when they're getting x-rays, when they're going for bloods, when they're dealing with a crisis in their families? The GP is the first port of call. How are we as a state supporting the GP network in East Galway and South East Galway? And also, Minister, how are we going to recruit in? We've seen the locum that's come into Kilconnell. The HSC had to bring in a locum. I know they're doing locums. There's about 10 other vacancies, I think, in the West. And the cost of these locums, it's 180,000. All the public representatives attended that meeting on Monday, and HSC representatives from Community Healthcare West. Really grateful that they were able to attend. And they highlighted that the cost of a locum in Kiltormer was 180,000, and that the overall cost of cover with Westdoc was roughly 500,000. Or 528. But Minister, these requests have been in each year. They've gone in last year, they've gone in the year before. You know, you think that, okay, the request has gone in from our area, from the HSC group in our area, but however, no funding is arriving. No funding has been allocated, and these GPs are at crisis point. Crisis point. We heard stories, Minister, you've heard them as well. You know, 40 hours working straight, 40 hours, and then somehow that GP has to get into a car and travel. It's putting doctors at risk, it's putting patients at risk. You know, there's no EU working time directive for GPs here. We need to protect our GPs. We need to ensure that we have a good quality of life balance. And Minister, I know you are so supportive of this. But Minister, unless we can do this, unless we can provide an environment for GPs who are passionate. You spoke with the GPs there. I know Dr. Genevieve Flynn, you spoke with Dr. Jennings. You know, you spoke with women who are performing in our region, in our area. But what about bringing in young GPs, young families, young women with families? How on earth are they going to support doing 1 in 8 rota, trying to work 13 days in a row? Doctors that haven't taken a break since January, who are afraid to bring locums in because if they do, the locums will not provide the same level of service as they do, and how are they going to be responsible for their community? There's a commitment, a diligence to patients in our local area. Minister, I've written a letter to Minister Stephen Donnelly. I know that you've also mentioned that potentially we might be able to hold a meeting. It is something that I know I've raised over the last number of years. I know that the GPs have been raising this over the last number of years. But we need a solution, Minister, and we need a solution that's going to take place. And is it going to be out of the winter service plan? Is it going to be from the budget that's been allocated for GP visit cards, and where they've stated that there's extra budget there for GPs and the GP network? Because we've expanded the GP cards to people now under a median income from April of next year. Where are the funds there that we can support our GPs right now? Because, Minister, I don't want to lose any more GPs in my region, and I am responsible for that Ballinasloe, South East Galway area. Garmagas.
Thank you, Senator. Minister.
Senator, and as am I, is responsible for the people of Southeast Galway. And you are quite right. We attended that meeting the other night. And, Chair, it's important for us to share with you, in attendance the other night was a selection of GPs right across the Ballinasloe, the Kilcollen, the Kiltormer, the Aircourt, the Lawrencetown. And actually, there was an outlier. Somebody came from Portumna. Dr. Fahy came from Portumna with me to attend. And the whole purpose of the meeting was to ensure that a creation of a cell in what I would deem technically in the Ballinasloe area, the need for the creating of a cell. But as you can see, Senator, from where the response from the department, that no additional funding to this request has been approved. The 528,000 that was sought from the HSE for the creating of this cell has not been approved under the budgetary allocation. I could come in here and I could give a very fluffy answer and skirt around the edges and not give it exactly as it is. So exactly as it is, no funding in budgetary 2023 has been allocated for the creation of a new cell in the proposal that has been forwarded by the HSE. What has been awarded is 2.5 million to the HSE in the West to ensure the continuation of the HSE Westdoc practices that are currently in operation. So that's 2.5 million that is going all the way, as I would say, that covers CHO2, which we discussed at length the other night, where we saw how much investment had gone in 2021 and in 2022. But now we have a real figure as to what that comes to, which it comes to 2.5 million for Westdoc in our area. But it completely excludes everything from the bridge in Portumna to the bridge in Banagher, all the way to South Roscommon, to the areas and the GPs that you talk about, including the Ballinasloe area. What gives me huge concern, and I raised with Minister Donnelly, is the fact that the GPs in the Ballinasloe area have served notice to withdraw their weekend cover from the 1st of December, and they were very, very clear about that. And if that was to happen, it would be the first time in 50 years that our GPs would withdraw from providing a service, but it would also be the first time in 50 years they would actually terminate themselves out of a contract, because they are contracted, of course, contracted but not supported. So I think, in fairness to Minister Donnelly, when I met with him, he said to me, just like what you have said there, let us discuss the winter plan, see if we've capacity within the winter plan to support. Now, to be fair to the Minister, I only sprung this on him yesterday, which was Tuesday. You were very rapid in putting in the commencement for today, so I haven't had that capacity space to have that conversation with Minister Donnelly and with my elected representatives from the area that were present the other night, who heard really very concerning effects it is having on the protection of our females within the practices and the out-of-hours service, that it is the pressure it is putting them under, and there is a health and safety piece. But not only that, there is a piece as well to ensure that we can maintain people within the practices and attract people into the practices in the area. So I would be confident we will meet with Minister Donnelly. We're just still trying to figure out his availability tonight, maybe after voting block. I'm not saying for definite, but we're looking for that space. And he himself has talked to me about the winter plan. And there's two parts of this conversation, Senator. There is the Ballinasloe cell and there is the Portumna piece. Because the Portumna piece sits on three borders. We sit on the county bounds with Clare, we sit on the county bounds with Tipperary. To be fair to Ballinasloe, they were never part of that arrangement. And I don't think they wish to be part of it either, because that would mean Westdoc would be covering from Roscommon Town all the way up to Portumna, all the way to Lawrencetown. That is not feasible either to ensure a proper delivery of a Westdoc service. So we have a Portumna piece, but we also have the Ballinasloe GP creation of a new cell. So hopefully when we get to meet with Minister Donnelly, we will be able to articulate, as you have quite eloquently put, the needs of representation for our GPs, but the need for delivery to support in the area.
Thank you, Minister. Senator, you have 1 minute.
Yeah, Minister, I know this is not an easy situation, but I must admit we do need that meeting with Minister Stephen Donnelly, as you've mentioned. That has to happen. It is incredible to say that we cannot support a network of GPs that, as you have stated, are entering into retirement age, have no support in place, and I know that it is impossible. We can't talk about legacy issues here, because right now we're talking about families and people living in Galway, living in South Roscommon, that will not have access to GP support. Will not have access. And yet we're saying, there we go, we're going to be expanding the GP visit card, we're going to be spending the largest ever HSE budget last year and this year, and yet we're not going to be doing anything about GPs or sláinte care or supporting our families on the ground. And yet our GPs are the first point of contact when it comes to our medical issues, when it comes to mental health issues, when we're trying to make sure that our families are supported. Minister, I am frustrated with this. I know our GPs are going to be really frustrated with this. The fact that there's nothing in the budget this year to support Westdoc and expansion of Westdoc services. It needs to happen. It needs to happen. It's not enough that 5 years that HSE have been asking for this. 5 years that they put in submissions year after year asking for support, and it doesn't happen. That's not good enough.
Thank you again, Deputy, but let's be very, very clear. The Department are funding the HSE. The HSE then, we give them the money, it's up to them to operationalise it. How they deem to operationalise it is as out of my control as it is out of yours. However, they are getting the funds to operationalise it, where they deem. But they are obviously not deeming South East Galway as a priority within their allocation of funding. So to get 4 million and not to see Ballinasloe as a priority, that to me is willful neglect. That's what it is. So I call on the HSE to go back to their drawing board and reallocate their funding and see equality for our GPs right across the county, not particularly easy ones where operational cells are easy to work. Operational cells that are difficult, like in Ballinasloe, need to be addressed head-on, and they need to reprioritise their 4 million, because it is not good enough that the likes of a GP above in Portumna on a weekend gets a half day off every weekend. That is not sustainable, it is not good work-life balance, and it is not good for their mental health. And I will work with you, Senator, on this.
Thank you.